just the love of our wonderful dog. Brought us much joy over 12. This has been when what you do is on some vaccination news. I sent you guys all, and I posted it in the description. Tremendous that I found in my tonight, right now, you to my description, cut and paste that I put there for you true seekers. I would recommend very strongly, if you are watching this video, that you would do that immediately, that you could drop down to the description box and copy those links that I left for you and put them safely on your computer before something happens and they're erased or removed. But only thing we're doing tonight is we're gonna present to you some vaccine research from what is coming out, so people can have the freedom to educate theirself on some of the things that are happening with the vaccine, both good and bad. This will be strictly research from the articles that I present to you. We'll start out this evening, as we always do, by saying our pledges. I pledge allegiance to the Christian flag and to the Savior for whose kingdom it stands, one brotherhood uniting all true Christians in service and in love. I pledge allegiance to the Bible, God's holy word. I will make it a lamp unto my feet and a light unto my path, and will hide its words in my heart, that I would not sin against God. Amen. That's our cry for all the truth seekers out there. So thank every single one of you for tuning in. I am going to jump right into these articles because I know I have a lot to share this evening. So the first article that I am going to read, some information that I found just released today, as a matter of fact, April 24, 2021. Just released out of the U.S. News, and they got a lot of this information from the CDC. So I hope everybody watching will understand the truth of it. The title of this article, if you ever want to look it up, this should catch your attention. 7,157 fully vaccinated Americans have contracted COVID-19. 88 of them are already dead. That came from the CDC. That's a number from them. The number of recorded COVID-19 cases among Americans, listen, who have been fully vaccinated against the virus that causes it is now over 7,100 at its last count, according to the health officials. I'm not making these numbers up. It is their numbers. The so-called, what they're calling this, the so-called breakthrough cases are reported by states to the Centers for Disease Control and Prevention, the CDC, which then releases these figures. In its new update, the CDC has reported 7,157 people who were fully vaccinated against the Chinese Communist Party virus, which causes COVID-19, still got the virus. Most of the breakthrough cases, 64%, took place among women, while 46% were among men or women aged 60 years old or older. Now listen to this, nearly 500 people who contracted COVID-19 despite being fully vaccinated required hospital care. Though about 1/3 of their illnesses were deemed unrelated to COVID-19, 88 or 1% of the breakthrough patients died. 11 of the deaths were reported as not showing symptoms or not related to the disease. The state-by-state breakdown of these cases is not made public yet. So this is just a small portion of what they're really looking at. The CDC first reported the breakthrough cases numbers on April 15th. The new update showed 1,343 such cases. The new figures are through April 20th. The CDC expects to update the numbers every Friday, a spokeswoman told the Epoch Times via email. Because of the current system relies on voluntary reporting from state health departments, there may be more breakthrough cases than the number that the CDC publishes. Did you hear that? There may be more numbers, not less. As of April 23rd, over 91 million Americans are fully vaccinated against the CCP, the China virus. Fully vaccinated refers to a person who received their second Moderna or Pfizer dose or their single shot of Johnson & Johnson vaccine 2 or more weeks prior. Now, we know that within the last 2 weeks, they have put a hold on the Johnson & Johnson because of the issues with the blood clots. But now they did not remedy the issue, and they put the Johnson & Johnson back on the market because they said it's an essential now to fight the virus, and that's just a part of the plan right now is some people are going to get blood clots. So they discussed the risk reward, and they said it's better to have the vaccine out there to get as many people vaccinated as possible, as quick as we could possibly get them vaccinated, and let the chips fall where they may. They don't feel that that amount of blood clots is a problem. None of the vaccines provide full protection. Did you hear that? None of the vaccines provide full protection, so health officials and experts say the breakthrough cases are not a cause for concern. I guess that would mean as long as that's not you or one of your loved ones. The thing that gets me about all this is it's public knowledge now that, let's say, 99% of everybody who gets the virus survives it. So there's a 99% survival rate. And we know of many people who got the virus, and a lot of people that got it, were asymptomatic. So for you got to do your own research, and you have to balance it out for yourself. While there are breakthrough cases, and they are not surprising, they are exceedingly rare and in no way undermine the value of the mass vaccination. Moreover, the breakthrough cases are uniformly less severe, showing the benefits of even imperfect immunity. S. Mark Thompson, professor of infectious disease at the University of Georgia, told the Epoch Times in an email, the CDC expects thousands of breakthrough cases to occur, a spokeswoman said. Vaccine breakthrough infections make up a small percentage of people who are fully vaccinated. CDC recommends that all eligible people get a COVID-19 vaccine as soon as one is available to them. CDC also continues to recommend people who have fully been vaccinated should keep taking precautions in public places. So this is another thing that interests me. Even though you're fully vaccinated, you still got to be cautious in public places. You still must wear a mask. You got to social distance. If there's a lockdown, you're locked down. If you want to visit your mom or dad in an elderly care facility, you cannot go in and visit them. It's not 100%, and people are dying from it. So my question would be, is why get the vaccination? That's just my question. Mr. Reed, good to see you're up with us, brother. Appreciate that. Like wearing a mask, he said you should keep taking precautions in public places, like wearing a mask, staying at least 6 feet apart from others, avoiding crowds and poorly ventilating spaces, and washing their hands often, she said. The CDC has said it is monitoring reported breakthrough cases for clustering by demographics. different geographical locations, time since vaccination, vaccination type, and virus lineage. It plans to soon focus on investigating only on breakthrough cases that result in hospitalization or death. Now, I'd like to stop here for 1 second and share with you, before I read actually an article from the CDC about the mRNA vaccine. We all know that our bodies are composed of DNA. That's what makes up our bodies. So let's say that the DNA have these, let's say they're spare tires or balls, actually, whatever you want to look at them of. But the DNA is what composes the cells of our body, holds us together. The mRNA, the M in that RNA, stands for messenger. And once you get the vaccine, that mRNA is like a rope that would go through those inner tubes, through those spare tires. And what that mRNA does as a messenger is it tells yours what to do. Now, it is synthetic, and one of the things that I've learned through my research, you can go back to my video last week in the description box. I had 7 of the best doctors that I found around the world teaching on this principle. They said once the mRNA is injected into your body, it will be there forever. And what the mRNA does is it is trained to fight against one thread, one strand of the COVID virus. Now, where there is a problem already is the COVID virus has several strands. But the mRNA that they're using now that they developed in a lab is only trained to attack or prevent this one COVID virus from getting into our systems and causing us to be sick. The second thing that many of the doctors say in my research is that mRNA is a bully. And when it is injected into your system, it tells your God-given immunity system to take a break. In other words, it benches them. It says, look, we're the new kid on the block. We're taking you and we're going to put you over there on the bench. So what that in turn does is over time, as it continues to overtake your DNA and your immune system, is the primary defense that you now have. Your God-given immune system that has been fighting off everything your entire life has been benched. He's put over there on the bench. And the only thing you have now would be the new mRNA. Now that, like I said, is the messenger that tells yours what to do. Well, like I said, after a while, they tell them to have a seat. They're the only ones in the game. And the only thing that they have been trained to defense against is one strand of the COVID virus. So let's say in 6, 8 months, 4 months, however long it takes for them to dominate your immune system, let's say you get another strand of the virus. Well, that's not going to stop that strand, obviously. So they would have to come out with another vaccine or another shot for that after they figure out what that is. Now, one of the other things that I talked to Lisa Joy about today, and I also discussed this with Rebecca, also Deborah, in my conversations today, is this shedding. And what shedding is, you need to do your own research on this, but shedding is once somebody gets the shot, that there is a amount of a protein that they get from the virus itself that is injected into people. Now, a concern of a lot of the doctors in the research that we've presented last week is this, that I just totally lost my train of thought there. Oh, about the shedding. Once that is injected into your system, it sheds onto the people that they're around. So the people who are, in a sense, being vaccinated, that there would be periods that they could possibly be asymptomatic, no symptoms whatsoever, but yet carriers of the virus itself. And I know recently, you got to ask yourself this. I know of so many people that have had severe headaches and different symptoms and colds and runny noses and coughs and chest colds and different allergic reactions over probably the last 30 days. And I'm thinking, could that possibly be from shedding? Could that be from people who got the virus, the shot, the vaccine, who have got the virus after that, or have the virus through the vaccine itself, but who are asymptomatic? So you need to seriously do your own research on these things, because it is available. The truth is available for you. Now, what I'm going to do is, with you being educated on that, the way that mRNA works, we're going to walk through one of the articles that I got exactly from the CDC. Now, listen, you already know, because I just showed you from the article, that there's well over 7,000 cases of people who have been fully vaccinated that now have the virus. That's a fact. So you cannot say once you're vaccinated, you're not going to get the virus. As a matter of fact, as I said, when you have those proteins in your body, you could actually have the virus but be totally asymptomatic. So when you're asymptomatic and you have the virus, you can shed that virus on the people that you are around. Okay, so right off of the CDC website, the title is, this is mRNA vaccines, what you need to know. Now, first point it tells us is mRNA vaccines are a new type of vaccine product to protect against infectious disease. Well, there's an issue right there, because I thought these were not new. I thought that these had been used before. I thought that there was long-term research on this. Well, you're finding out when you look on here, it says mRNA vaccines are a new type of vaccine to protect against infectious disease. mRNA vaccines teach, here it is, mRNA teach our cells how to make a protein, or even just a piece of a protein that triggers an immune response inside our bodies. That messenger RNA tells the cells in our body, they're not saying what it tells you to do, but the doctors on my previous lesson that I had put up in the description box tells our cells to hit the road. Our God-given immune system that has worked in my life for a very long time. I was going to say my age, but I'd rather not do that. So the third point is this: the benefit of mRNA vaccines, like all vaccines, listen to this, is those vaccinated gain protection without ever having to risk the serious consequences of getting sick with COVID-19. Well, wait a second. There's already been over 7,000 people just in the cases that where we looked at. It's not, they haven't even done the research in all the states yet. That was just a small piece of the pie of people that turned that information in. There's already over 7,000 people that are full-blown COVID-19. 88 out of that bunch are already dead. We don't know what's going to happen to the rest. So I don't know how they could put out some of these things that I've read off of their own website. So I'm just presenting tonight the facts and hope they just don't nuke my whole message again. That's why I really encourage you, as soon as you see this, you need to take that link and copy it and share it with your friends and family. So messenger RNA vaccines, also called mRNA, see, they're messenger RNA vaccines, are some of the first COVID-19 vaccines authorized for use in the United States. Very interesting. They're a new approach to vaccines. mRNA, well, a lot of people think that there's long-term studies on these. They talk like these have been around a long time. These have never been used before in the United States, and all of a sudden they're mandatory and they're making as many people as they can get the virus as quick as possible. Now, hey, if they were proven and there was long-term effects known from these, there wouldn't be nothing wrong with it. But if people are going to be dying from these from 4 months to 14 months, according to our research last week, all hell could hit the earth in 4 months to 14 months. Please keep that in mind when you consider getting the vaccine or not. mRNA vaccines are a new type of vaccine to protect against infectious diseases. To trigger an immune response, many vaccines put a weakened or inactivated germ into our body. That is the COVID-19 virus, not mRNA vaccines. Instead, they teach our cells how to make a protein or even just a piece of a protein that triggers an immune response inside our bodies. That immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our body. So, when we're injected with the COVID vaccine, say Moderna, it is trained to stop this strand of the virus only. That's it. But what it does is it tells our God-given immune system, remember, go to the bench. So the only thing you have is this vaccine that has been injected into your body. It will tell yours to take a hike, and it will only be there for that one strand. Now, according to the CDC website, a closer look at how COVID-19 mRNA vaccines work. COVID-19 messenger RNA vaccines give instructions for our cells to make a harmless, that's a matter of opinion. mRNA vaccines give instructions for our cells to make a harmless piece of what is called the spike protein. Please understand what that is. They say it's a harmless piece of what is called the spike protein. The spike protein is found on the surface of the virus that causes COVID-19. It is a piece of the protein that causes COVID-19. That is injected into your body. So what the effect is on your body, you will find out if you decide to get the vaccine. But one of my other concerns is through my research, I found this term called shedding. And this happens when people who are fully vaccinated are around people that are not vaccinated. The people who are vaccinated could be totally asymptomatic. They could be carriers of the disease or the virus, but show no symptoms. But yet you could still catch it from them. Example, a lot of people I'm around now come up to me, hey, Pastor Ron, I got the vaccine, hallelujah. And they're hugging and wanting to hug and shake your hand and all this stuff. And I'm like, whoa, wait a second. that means I know that you now have a piece of the protein of the virus within you. Now, you may be supposedly protected by it, but what does that do for the people who aren't? I'm just saying. So that is a concern. First, it says here, COVID-19 messenger RNA vaccines are given in the upper arm muscle. Once the instructions are inside the immune cells, the cells use them to make protein pieces. Did you hear that? Once it's injected in you, the cells are used to make that protein piece over and over and over again within your body. After the protein piece is made, the cell breaks down the instructions and then gets rid of them. Number two, next, the cell displays the protein piece on its surface. Our immune system recognizes that the protein doesn't belong there and begin building an immune response and making antibodies, like what happens in natural infection against the COVID-19 case. Well, what they fail to tell you here is that the vaccine that's placed in your body, remember, tells your immune system to sit down because they're like bullies and they want to take over. At the end of the process, our bodies have learned how to protect against future infection because we've been injected with the infection. The benefit of the mRNA vaccine, like all vaccines, is those vaccinated gain this protection without ever having to risk the serious consequences of getting sick with COVID-19. Well, all of a sudden, this is a major concern because there's a lot of people getting sick with it after they have been fully vaccinated. So this is a concern. So let me stop right here, and I'm going to go back to my research so we can look at another opinion here, that some facts regarding what is really happening. So the title of this next article that you could get in my description box below, so you can copy and paste before they erase or somebody does not like my presentation and they censor me. I think it would be very smart for you and very, very beneficial if you would grab this information and download it somewhere so it's safe on your computer as quick as possible. Okay, the next article I want to share with you. Denmark drops AstraZeneca COVID-19 vaccine amid reports of blood clots. Did you hear me? Denmark drops it after blood clots. Now, let me read you the article. This is coming straight from the article. It's done by Jack Phillips on April 14th. Denmark became the first country in Europe to abandon the use of AstraZeneca. We know the Johnson & Johnson had the same issues, COVID-19 vaccine. After the country and more than a dozen of other European Union nations suspended its usage. Denmark's health agency director, Søren Brostrøm, said Denmark won't use the shot as a part of its vaccination campaign, even as the World Health Organization and the European Medicines Agency have said the benefits of using the AstraZeneca shot outweighs the negatives amid reports of blood clots. Listen, I am telling you, they want as many people as humanly possible to rush and get the vaccine. Why? It will be used to control the masses around the world. Period. It will be used for population control. Overall, we must say that the results show that there is a real and serious side effect signal in the vaccine from AstraZeneca, said Brostrøm in a statement. Based on an overall consideration, we have therefore chosen to continue the vaccination program for all target groups without this vaccine. Noting that it's been a difficult decision to make, Brostrom said the upcoming target groups for vaccination are less likely to become severely ill from COVID-19, and officials must weigh this against the fact that we now have a known risk of severe side adverse effects from the vaccination with AstraZeneca, even if the risk in absolute terms is slight. Danish officials previously said that 2 people who received the vaccine against the CCP virus suffered from severe blood clots. One of them died, they said last month. On April 7th, the EMA said in a statement that there's been a possible link between blood clots and the vaccines, adding that it is reminding healthcare professionals and people receiving the vaccines to remain aware of the possibility of very rare cases of blood clots combined with low levels of blood platelets occurring within 2 weeks of the vaccination. So far, most of the cases reported have occurred in women under 60 years of age within 2 weeks of the vaccination. There's a whole lot of women out there that's under 62 years of age. Based on the currently available evidence, specific risk factors have not been confirmed, it stated. So then it goes on just to say about how the Denmark decided to stop using this vaccine. So let me get back to my information. I have a couple of these articles I really want to share with you. Let me go back to this. Listen to this article. 142 fully vaccinated people in Houston test positive for COVID-19. This is a strand that goes through every single article I found. Why risk the vaccine if people are testing positive who have been fully vaccinated? That's the whole question. So if you've already been vaccinated, you can't back up. But what I'm saying is for the people who haven't, you need to educate yourself on facts to know if you want to do it or not. That's all I'm saying. 142 fully vaccinated people in Houston test positive for COVID-19. Well, this came out April 14th. Well, before these research had been done by the local doctors and healthcare facilities, people were being told from the article I read you from the CDC that once you were fully vaccinated, you couldn't get the virus. So more than 140 people in Houston have now tested positive for COVID-19 more than 2 weeks after being fully vaccinated against the virus that causes the disease. Health experts in the Texas city confirmed, according to data provided by Houston Health Department, the number of Houstons who were infected with the Chinese Communist Party virus after being fully vaccinated was 142 residents who have been fully vaccinated. The data of the potential so-called vaccine breakthrough cases date back to January when the first wave of the recipients received a full vaccination. Breakthrough cases refer to COVID-19 cases that appear in people more than 2 weeks after they have been fully vaccinated against the virus. I want to inform you that this just isn't worldwide. This is just in the cities that have decided to see what is really happening just 2 weeks after people are vaccinated. What's going to happen 2 months or 4 months or 8 months or a year or 14 months? What's really going to happen? What is this going to do to our God-given immune system? It's something that you must ask yourself. COVID-19 is caused by the CCP virus, commonly referred to as the novel coronavirus, which originated in China in late 2019. Dr. David Percy, the city's chief medical officer, said residents becoming infected after being fully vaccinated is not unexpected. It's unexpected to me because everything I read on the CDC said once you're fully vaccinated, you're not going to get the virus, or you would be asymptomatic, because the shot does not grant recipients 100% immunity. Then why get the shot? This vaccine is not dissimilar from other vaccines in that it gives you some level of protection, but no vaccine is 100% effective, he said. While tens of hundreds of thousands have been vaccinated in the community that is still viral spread, it's not too big of a surprise there are a small number of people who have become infected. None of the Houstonians who tested positive for COVID-19 after receiving the shot required hospitalization, Percy said, saying symptoms are usually very mild with vaccinated people testing positive compared to unvaccinated people. Fully vaccinated refers to people receiving both doses of the vaccine produced by Moderna or Pfizer. A third option from Johnson & Johnson, which is currently suspended in the United States after reports of rare blood clots among recipients after a single dose. A number of U.S. states have recently seen similar infections among Americans who are fully vaccinated, including, now these are other medical professionals that are finding infections in people who are testing positive for the COVID virus after they are fully injected with the vaccination, taking the vaccination, including Idaho, Florida, Michigan, Minnesota, South Carolina, and Washington. Michigan data shows 246 residents tested positive for COVID-19 more than 2 weeks after being fully vaccinated. So I think we're seeing that it's not true to say that everybody that receives the vaccine is not going to get COVID. We know that's not going to happen because that's happening. But my concern is what about for the people who choose not to get the vaccine? And if the shedding happens, and it's true because they're injected with the virus, they will just simply be asymptomatic. They'll be carriers of it that would possibly infect those who have not been vaccinated or whose immune system might be volatile to that. 11 of the residents were hospitalized and 3 died. A spokesperson with the State Department of Health and Human Services told the Epoch Times via email the people who died were all 65 years of age or older. In Washington, more than 100 people tested positive after being fully vaccinated. You start adding up these numbers. Authorities said on March 31st, of those recipients, 8 patients required hospitalization and 2 have died. All contracted the virus more than 2 weeks after being fully vaccinated. Finding evidence of vaccine breakthrough cases reminds us that even if you have been vaccinated, you still need to wear a mask, practice social distancing, wash your hands, and prevent spreading COVID to others who have not been vaccinated. Well, wait a second. What does that mean? Rewind the tape, please. Listen. You still need to wear a mask, practice social distancing, wash your hands to prevent spreading COVID-19 to others who have not been vaccinated. Washington Secretary of Health Umar Shah said in a statement. Okay, we're going to go to the next article. I am just wanting to present you with factual proof. Here's a good one for you. I'd like to get this one in. The CCP virus variant affects vaccinated people more than unvaccinated people. Did you hear that? Did you hear that headline? Hello, listen. The CCP virus, the COVID virus variant, affects vaccinated people more than unvaccinated people, the study said. This should interest you. Now, CCP virus variant affects vaccinated people more than unvaccinated, this study said. This comes from Jack Phillips on April 11th, 2021. A study from Tel Aviv University found that a South African variant of the Chinese Communist Party virus affects people vaccinated with the Pfizer shot more than unvaccinated people. Am I making that clear enough to you? The people that are vaccinated are affected more by the COVID virus than people who are not, that don't have the vaccine. The study, which has not yet been peer-reviewed, indicated that the B.1.351 variant of the virus was found 8 times more in individuals who were vaccinated compared to people who were not vaccinated. The Claylid Health Services, a top Israeli healthcare provider, also helped in the study. Listen to this. We found a disproportionately higher rate of the South African variant among people vaccinated with a second dose compared to the unvaccinated group, said Audie Stern of Tel Aviv University. This means that the South African variant is able to some extent to break through the vaccine's protection. Okay, you get shot with the COVID vaccine. It is designed to protect you against this guy. But all of a sudden, this guy's smart. So he produces an African variant. Your defense system has already begun to tell your God-given immune system, you're fired, boys, you need to go sit on the bench. And they are only instructed to attack this guy. All of a sudden, it's mutating. So we already have a South African variant, a variant of the virus that these guys over here are attacking your immune system. And this guy here is simply just touchdown, 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 touchdown. No one's fighting it. I hope you're getting the picture. I hope you're getting the picture. Now, the study looked at 400 people who received at least one shot of the Pfizer biotech vaccine and had contracted the COVID-19 variant, and compared them to the same number of people who were infected and unvaccinated. Moderna's vaccine is also used in Israel, but it is not included in the study. I wonder why. It is the first in the world to be based on a real world data showing that the vaccine, showing that the vaccine is less effective against the South African variant compared to both the original virus and the British variant. How many variants are there now? That's what you got to ask yourself. Because we keep hearing of, oh, there's another one, there's another one, there's another one, there's another one. How many variants are there? Because remember, the vaccination is designed, your messenger RNA that's injected into you is only designated to fight the one variant, because the other variants weren't in existence when they created the defense against it. Patience is a virtue. Compared to both the original virus and the British variant, said Professor Rand Baliser, director of research at Kalit, according to news reports. Stern said the study's findings came as a surprise. Well, hello, because everybody at the CDC and everybody else is swearing that once you get this, you're good, so everybody should get it. No one's going to get sick. Obviously, a lot of people are getting sick already who have received both shots. So I'm just saying that you need to do some research for yourself so you know what the mRNA is about. Based on patterns in the general population, we would have expected just one case of South African variant, but we saw 8. Lord help us. Lord help us. Did you hear that? If I had Deborah's phone, ring, 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 I'd be on the phone ringing it. Based on the patterns in the general population, we would have expected just one case of the South African variant, the variant of the virus, one case. But we saw 8 different variants that are out there multiplying and multiplying and multiplying and multiplying. And you have received a vaccination with the risks that it has that's designed for one of the COVID-19. I hope this is making sense. And I think you better get on the horn, copy what I have in the description box below, and share this video as soon as I'm done, because I'm just having a sneaky suspicion this one might not be around too long. So, but we saw 8, Stern told the Times of Israel. Obviously, this result didn't make me happy. Even if the South African variant does not break through the vaccine's protection, it is not spread widely through the population yet. These preliminary findings necessitates close continued attention to the decimation of this strain that is now in Israel. Well, Israel is the one who made the vaccination absolutely mandatory, and they got the COVID passport going full tilt, and everybody there gets the vaccination. Remember, shedding. Emphasizing the need for epidemiological monitoring and systematic sequencing in order to contain further spread of South African variants in Israel. The South African variant accounted for less than 1% of all COVID-19 cases in Israel, reported to AFP, citing the study. This means that the Pfizer biotech vaccines are highly protective, probably does not provide the same level of protection against the South African variant of the coronavirus, the study said. Israel separately has rolled out a so-called vaccine passport. Hello? Israel separately has rolled out a so-called vaccine passport. They should know better. Israel should know better. Remember the Holocaust? System that allows people who have been vaccinated privileges over individuals who are not vaccinated. So if you're not vaccinated, you're not going to the football game. If you're not vaccinated, you're not going to work. If you're not vaccinated, you can't buy or sell. I mean, that sounds like some scriptures to me, to Revelation about 13 verse 6. That unless you receive the mark of the beast, you will not be able to buy or sell. I'm just saying. Such systems have been criticized by civil liberty groups, saying it would be an infringement on people's rights, including privacy, and would potentially create two-tiered class systems of vaccinated and unvaccinated people. COVID-19 is the disease caused by the CCP virus, novel coronavirus. Listen, folks, this is some serious stuff. This is some serious information. I would pray that you would get this to your loved ones as soon as possible. This research is not easy to find, but I do my best to get it to you as soon as possible. I will close with this one. Over 100 fully vaccinated people in Washington just test positive for COVID-19. Here we go. Bert, thank you. I've been trying to do some good research for you guys. Greg Sunderland, the doctor, says, sounds like a real horror story. Rhonda, good to have you on with us. I appreciate the pat on the back. You need it every now and then. Listen, we're in a battle. I'm telling you, this is a battle. There's an ulterior motive to all this. And I think we need to sound the alarm. Over 100 fully vaccinated people in Washington state test positive for COVID-19. Epidemiologists have found evidence of 102 so-called breakthrough cases. That number represents 1%, 0.01% of people in the state who have been fully vaccinated against the Chinese Communist Party virus. The CCP virus is also known as SARS-CoV-2. 8 of the patients required hospitalization, and 2, both over 80 years old with underlying health issues, have died. All others contracted the virus more than 2 weeks after being fully vaccinated. Fully vaccinated refers to people receiving both doses of the vaccine produced by Moderna or Pfizer. A third option from Johnson & Johnson is a single dose. We know that the World Health Organization and the CDC said, no, pull the Johnson off the shelf. And then I think they got some blowback on that from the people that want to control the population. And they said, regardless of who's dying from blood clots, we're going to put it back on the market. So let's roll with that. I don't agree with that decision, but I'm not in that position. According to the Washington State Department of Health, further investigation is needed to identify patterns among people who contracted the virus after the vaccination. They're taking a partial protein of the virus and putting it in your body. The cases are confirmed with a positive test. Investigators then work to determine details on what actually happens. It is important to remember that every vaccine on the market right now prevents severe disease and death in most cases. People should still get vaccinated as soon as they're eligible and encourage friends, loved ones, and coworkers to do the same. I don't agree with that. Finding evidence of vaccine breakthrough cases reminds us that even if you have been vaccinated, you still need to wear a mask. Every article said this. It amazed me. You still need to wear a mask, practice social distancing, wash your hands to prevent spreading COVID-19 to others who have not even been vaccinated. According to the U.S. drug regulations, Pfizer's vaccine is 95% effective in preventing infection in the CCP virus. Moderna's was shown in a clinical trial to be 94% effective, while Johnson & Johnson was only 66% effective. The percentages are for 2 weeks after the final vaccination. Other states have seen infections among people who were fully vaccinated. Officials in Idaho told reporters last week that the breakthrough cases have been recorded, although the number was fewer than 100. South Carolina authorities said this week that 134 such cases have been identified throughout the state. Dozens of patients in Florida have contracted the CCP virus more than 14 days after being fully vaccinated. This is serious stuff, guys. Bert says our neighbor got COVID 2 to 3 days after getting the Johnson & Johnson vaccine. His wife got 3 to 4 days later. She did not get the vaccine. They were down for 5 weeks. Thanks for sharing that, Bert. Rhonda, that's good news. God has not told you to be vaccinated yet. I don't think he will. The Minnesota Department of Health is among the health departments issuing advisories about the breakthrough cases. This is a serious concern. Let me see what else we need to share here. Talks about what's going on in Minnesota. Listen, folks, I've given you enough information tonight. I hope you really do share this. I mean, as fast as you possibly can, because you know from my previous videos what they do. They take them off. They're usually off within a day or two. So I pray overnight you can forward this to your friends and families, develop a contact list, get it to as many people as you possibly can. My whole goal this evening was to encourage you to educate yourself. You just don't go jump off a cliff because someone tells you to jump off the cliff. It would behoove you, it would be very smart to make an educated decision regarding life and death. That's all Pastor Ron is saying. Please educate yourself. Do not do anything so foolishly. The facts like this are already coming out. We're only a couple months into this thing. No one has really even did the research yet. These are just states that are beginning to do it. Who knows how many people's really died? Who knows who has really been infected by shedding? I'm sure you have not heard about shedding yet. But they will release it. They'll tell you that people who have been injected with the vaccine have enough of the vaccine in them that they're asymptomatic, but they can pass the virus on to you. We've just not been educated on that yet. But now you have. So the ball's in your court. I love every single one of you. Deborah sends her love, and we will all pray for her and continue to pray for her and everybody who has been under an assault lately. And this might have something to do with it. So, Bart, thank you once again, and greatly appreciate your encouragement. We love every single one of you. Thank every single one of you for all of your love and support. If you watch us on the Faith Family channel, I thank you for all of your letters, all your emails, any of your financial support. I really support and thank every single one of you. If you watch us on crossingpaths.org, you can go to our website and watch all of our television shows right there. You can also donate on our crossingpaths.org website, or you could make a donation on our His Food Ministry website. They are all found in the description box below. We love every single one of you. I have done my best to present to you the best packet of information that I have. You need to go back to last week's video. Go to the description box. There is 7 links. If you do want to be on my VIP email list, please send me your email. Don't tell me just put me on. I need your email. So please send me your email so I could put you on my database. I send out 2 emails every single week to probably about 7,000 people. So I would love to put you on that. So I love every single one of you, and my time's about to run out. So once again, to all you true seekers, you know how we say it, keep on seeking. Till then, this is Pastor Ron signing off. Please share this. Give us a thumbs up. Get it to as many people as you possibly can before they remove it. Love you guys. God bless you. Keep on fighting the fight and keep the faith.